Well, good evening and welcome everyone. Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckbill and I will be serving as your program facilitator and will present your questions to our panel of experts. Tonight, we'll be answering your questions about erectile dysfunction, its impact on one's health, and existing treatment options. Well, thank you for submitting your questions in advance of tonight, and the questions that you will hear me asking the panelists are all submitted right from when you registered for this webinar. And if you have any questions throughout our discussion tonight, for those joining us on your computer or tablet, at the bottom of your screen, you'll see an icon that says Q&A. We'll do our very best to get to as many questions as possible, but may not be able to answer all of them during tonight's virtual event. And due to hospital university guidelines and privacy, we are unable to comment on specific cases. Likewise, if you're experiencing any symptoms that may require immediate medical attention, please consult a medical professional. All right, well, without further ado, I want to go ahead and introduce our experts for the evening. First, this will be Dr. Paul Chung with Urology and Trauma and Reconstructive Urology, and Dr. Perry Weiner, Urology and Men's Health. Well, let's go ahead and have you both just introduce yourselves before we dive into the questions. So Dr. Weiner, we will go ahead and start with you. How are you doing this evening? Oh, and I think you're on mute.
How are we doing?
Doing well. How are you?
Great. Yeah, I'm fine. Thanks. I appreciate that. I'm doing well, and I appreciate the opportunity to participate tonight and ask everybody to be open with their questions and happy to answer.
Absolutely. All right. Well, thanks for joining us. And Dr. Paul Chung, how are you doing tonight?
I'm doing well, Sarah. Thanks for the invitation, and thanks for everyone joining today. I hope you'll be able to find something educational for you that can be helpful in your life.
Absolutely. All right. Well, again, thank you for joining us. And I know we have a lot to get to. There were a lot of submitted questions, so we certainly will have a lot to discuss. So without further ado, let's kick it off with our first question. And Dr. Chung, this one is for you. What are the main causes of erectile dysfunction?
This is a good question to start with. I think it's important first to understand how erections actually occur. And this will allow people to understand how different medical issues along that pathway can cause erectile dysfunction. In order for a patient to be able to get an erection, the first thing that's needed is that the brain needs to send a signal telling the body, allow blood to enter into the penis. So that's number one. Number two is that the appropriate amount of blood needs to enter into the penis to be able to obtain an erection. And then number three is the blood needs to be able to stay in the penis to be able to maintain the erection. So any type of issues along that pathway can result in erectile dysfunction. So for example, someone who may have a spinal cord injury or a prostate removal surgery where the nerves may be injured don't have that signaling. Patients with diabetes or high blood pressure or any type of vascular disease who have poor blood flow and poor blood vessels can have an insufficient amount of blood flow entering into the penis. And then there are some patients who experience a trauma or perhaps even sometimes born this way. They have high outflow where the blood doesn't stay in the penis and exits too quickly and also can cause erectile dysfunction. And even some patients have a combination of these issues. So that's why it's important to see someone who is focused in erectile dysfunction, like Dr. Weiner and myself. So that way we can help kind of establish why it happened, because many people want to know why.
Absolutely. Okay, well, thank you so much, Dr. Chung. All right, for this next question, we're going to talk a little bit about surgery. So Dr. Weiner, can you talk about surgical and non-surgical options for ED?
Sure. Just to begin to say that there is no stepwise fashion that should be utilized. In other words, it's completely acceptable for a patient who has experienced erectile dysfunction to choose one particular therapy and not necessarily have to go through a step therapy such as going through medications, injections, and then deciding on surgery. People can decide on a surgical procedure if they want up front, and that would be quite all right. But typically what we do is we'll, after patient's problem is diagnosed and appropriate laboratory testing is performed, we'll go ahead and start off with medical therapy. So medical therapy would be drugs that everybody's heard about, such as Viagra or Cialis. These drugs are very effective, and to address Dr. Chung's point, what the medications do is that they open up blood vessels and they allow for blood to flow into the penis to allow the erection to occur. Now, of course, you need to have a blood supply that's sufficient and responsive to that, as well as an intact nerve system, which allows that signal to occur. So medical therapy is the initial response for most physicians. We can also utilize injection therapy. Injection therapy actually takes a very thin, tiny needle, similar to the type of needle that diabetics use for diabetes management. And although it might sound horrifying, a very tiny needle is utilized to inject into the side of the penis with some medication, which has what we call vasoactive agents, or agents that directly act on blood vessels to allow them to dilate. This should be done under a physician's supervision, because inappropriate use of the medication can be dangerous with some very, very serious side effects. Another alternative would be a pump. And a pump is a cylinder which evacuates blood from the penis, and the penis is placed inside this pump, which is put up closely against the body to create a vacuum seal. Air is withdrawn from that, which encourages blood to flow inside to the penis. But again, we need to have an intact blood flow for that patient to respond appropriately. So those are some of the non-surgical ways. A very new and exciting treatment, which we're doing here at Jefferson, and Dr. Chung will, I'm sure, address this in an upcoming question, is the use of wave therapy. Wave therapy has become very popular lately. We hear about it on all sorts of television advertisements at different types of places in the Delaware Valley. And what it does is it stimulates the production of nerve and blood vessels, we believe, to allow for new blood vessels to come in and supply sufficient blood to the penis. And it's very, very good as an adjunct or an assistance to existing medications. So if you're getting a fair response to medical therapy, we think that the use of this will boost the response to the medical therapy, so that the patient gets a better response when they take a pill such as Cialis. Those are some of the non-surgical methods, and certainly the gold standard for all treatments still remains for erectile dysfunction surgical therapy. Surgery would involve the placement of a penile prosthesis, and these can be either malleable or inflatable. Malleable devices are similar to a gooseneck lamp, where and it's good for patients who have difficulty with dexterity, for example, and may have difficulty manipulating the pump of the inflatable device. But this is a device that has no moving parts, and it's placed inside the penis. And when you want to participate in intercourse, the penis is lifted up. The inflatable devices are more natural in appearance and cosmetics, and they're more easily concealed, and they give a very, very good erection. But the way they work is there's a cylinder with a pump that's placed in the scrotum sac, and a reservoir which holds sterile saline, which is placed deep inside the body, so it's not visible and not felt. And when you want to have intercourse, the pump is activated, and at the end of intercourse, the device is deflated, and the fluid circulates within the system, completely closed off from the rest of the body. And these things last for many, many years. They're designed to last 15 years or so.
Okay, well, thank you so much for walking through that. And just as a follow-up, what would be the downtime for those surgeries that you just discussed?
So for penile prostheses, the patients are either discharged the same day or after a very brief overnight stay in the hospital to manage any discomfort that may be present. Everybody has their own protocol. My particular protocol is to see the patients and follow up in 2 weeks to make sure that everything is healing properly. And somewhere between 4 and 6 weeks after the surgery, We activate the pump, make sure that the patient is comfortable to use it, make sure that it's in a satisfactory position, which is something we do before the operation is completed. I would say that all implanting urologists test the device with inflation and deflation several times before the end of the surgical procedure to make sure that it's in the proper position and is working fine. So 4 to 6 weeks after the surgery, I walk through the procedure with the patients, and that's it.
Okay. All right. Well, thank you. Okay, moving on from surgery, let's talk a little bit about medication. So Dr. Chung, what are some of the medications that can help treat ED?
The category of medicines that we're going to talk about are called PDE5 inhibitors. There's a few of them that are involved. You may know them by their brand names: Viagra and Cialis, Levitra, Stendra. These medicines always have a generic name to them: sildenafil, tadalafil, vardenafil, for example. As Dr. Wiener mentioned, it's important to understand the function of these drugs. They help to increase blood flow into the penis. There are different kind of ways in which the medicines can be a little bit different, but in general, mostly we really try to prescribe the generic Cialis and the generic Viagra, at least in my practice, because that's what patients are typically able to get based on their insurance company. A few of the other ones, like Levitra and Stendra, can sometimes be obtained based on their insurance company, but for a majority of people, it can be difficult. And for some patients, their insurance plans won't even cover these medicines at all. So that's often where the generics are a good option because of the price point. In terms of the medications, they do need to be timed, meaning that in general, depending on which one you're taking, it could be anywhere from 15 minutes to 60 minutes that you need to take these medications ahead of time in preparation for that sexual activity. Cialis is a unique one in the fact that you can take it daily to allow for more spontaneous sexual activity. But most of them you need to take on demand. So this obviously has a challenge to it. So some patients don't want to think about that. They don't want to worry about, I'm going to have a big dinner. Is this medicine going to be absorbed? So some people can feel not confident with the medicines and not sure how it might work. Some patients also have side effects with the medicines. They could be a headache, even seeing a blue color, having some congestion, a stuffy nose. Fortunately, for most patients, they don't experience that significant side effects. But unfortunately, for a small number, they have side effects that are so significant that they can't even tolerate the medicines. In terms of medication, one other thing would be many people ask, can I try all of them? And I would typically tell my patients that they work by the same mechanism. So I think it's reasonable to try 2, maybe 3 if their insurance covers it. By no means does someone need to try all of them if 1 or 2 aren't working the way that they like to. In terms of efficacy, these medications have limitations. So yes, they are designed for erectile dysfunction and meant for patients who have erectile dysfunction. However, for some patients, their erectile dysfunction may be so severe that they are not going to receive the response that they want, or that the response that they need, or that they're looking for based on the medication, even though they may be taking the highest dose that exists. And the last thing that I want to say is that in terms of medications, if the insurance does cover it, often the insurance limits how many tablets you can have per month, and they say you can have 6 tablets a month and that's it. And also for the patients who don't get good coverage with it, they often experience high out-of-pocket costs. So if you are faced by any of those challenges, please know that when you pay out of pocket, there are many, many different ways in which you can get these medicines significantly cheaper if you just look online. And often when you have to worry about trying to get a pre-authorization through your insurance company, although you paid for your insurance and you want your insurance to cover it, sometimes it's a lot easier and even cheaper to just go pay out of pocket and go through one of the discount pharmacy programs.
Okay, thanks for that call out there. That's helpful. along these same lines, I guess, for people who maybe don't want to take medication, are there any non-medication options? For example, maybe supplements, herbs, exercises that could possibly help?
Yeah, we get a lot of questions about this. I think the first thing is understanding what the difference between a medication is and what a supplement is and how they're designed and how they're studied. Drugs are regulated by the Federal Drug Administration. So drugs go through clinical trials. They have proven efficacy. There's a standard of purity and known concentration of the drug within that tablet. The challenge with supplements is that they are not regulated by the FDA. So supplement companies can technically make what they want, claim what they want, and produce what they want and put it on the shelves. Fortunately, there are some supplement companies that have kind of vowed and to take a good stand in terms of making good supplements. However, the challenge with it is that the purity and efficacy is not always well known. So there was a study done with it by a urologist a few years ago, kind of evaluating the health of supplements. And, I won't go through all of them and describe, I don't recall the specific details, but basically the summary statement is that even though these drugs can be easily, these supplements can be easily obtained, some of them can actually have some detrimental side effects. So just because they're accessible at the gas station, at your grocery store or whatnot, they may not work. And when you look at the cost of some of these supplements, often they're more expensive than the medications themselves. And patients don't always notice that. I personally feel that in terms of supplements, it's not always that the patient that's their main goal. I think patients are willing to take medicines. I think the hardest thing is for them to kind of see somebody like Dr. Weiner or myself and finally get in the clinic and have that conversation about what they're experiencing. And because they may be reluctant to do that, they kind of get the supplements that first, because those are easily obtained. And just outside of that, so I kind of just tell patients, perhaps to save their money and try something more efficacious that we have data for. Many patients also ask, what else can I do? In general, obviously, the best thing that we can do for ourselves is to lead a healthy life, eat healthy, exercise. We all know what healthy is. It's just a matter of trying to do that. So what's good for the heart, imagine, is good blood flow. Remember, we talked about what you need to get an erection. You need good blood flow. So in general, a good summary is heart health is also good for penis health.
Okay, thank you. And thank you for sharing those insights on supplements. Very interesting. Okay, and I have one last follow-up here about medications. Can you talk a little bit about medications that may contribute to ED? So for example, blood pressure, cholesterol, or even antidepressant and anxiety medication.
So this is tough because going back to the pathophysiology or the causes of ED, we talked about high blood pressure, for example. Some patients may have anxiety, which can contribute to blood pressure. So many of our patients with erectile dysfunction are taking these medicines already. You are correct. Some of these medicines can affect erectile function, such as blood pressure medicines and anxiety meds or antidepressant meds, most commonly. Fortunately, not all patients experience side effects from these medicines. The challenge with this is that when they come to see a urologist, Dr. Weiner and myself aren't at liberty to just stop these medicines, right? These medicines are given for a function and often for a real need that the patient experiences. So often we can at least identify these medications, suggest to the patient, oh, maybe there's an alternative that you can try in order to, an alternative medicine that you could try that maybe has less side effect that your provider may be willing to change in that manner. But sometimes we have to keep these medicines on, and therefore patients may be more inclined to try some of the other treatments that Dr. Weiner mentioned in order to help improve their erectile function. And the last thing is, as part of the men's health clinic, we're really trying to motivate men to have good health. Obviously we're talking about erectile function today, but when we see these patients in our clinics, often what motivates them the most is their erectile function. That's what brought them there. The challenge with high blood pressure and diabetes and things like that is that often you feel good when you have the disease. You don't know that it's hurting you. So this is an opportunity for us to educate men and help them to get their health better, so that perhaps they can even stop their blood pressure medications and improve that so that they don't take it anymore. And then that can help their erectile function.
Okay, thank you. So looking at that preventative care. All right. Dr. Weiner, we will turn to you now. Is there anything that can be done to reverse ED? Is it curable?
Yes, ED is definitely curable, as Dr. Chung has alluded to, in terms of different management styles and different management alternatives. But the underlying cause is something that should be addressed. And to reiterate what Dr. Chung appropriately put out was the idea that, let's say, whatever your underlying issue is, could it be reversed? So, for example, hypertension. Hypertension means the blood vessels are very stiff. The heart has to pump harder to get blood flow to an area, and typically that may happen because of deposition of cholesterol products, lipids, fatty substances, which go on to lead to a heart attack. So, I'll mention that it's been proven that erectile dysfunction is one of the earliest warning signs of the development of future heart disease. So, to the extent that a patient can lead a healthy lifestyle by limiting tobacco, their number one cause of erectile dysfunction, managing their diabetes, managing high blood pressure, managing cholesterol, exercising, and a good diet. I don't know that we can actually reverse the damage per se, but we can minimize future damage. And importantly, to the extent that there are some medications which may be contributing to difficulty with erection. For example, classically beta blockers, drugs like Inderal, propranolol, which is an old heart medication. The number one side effect of that medication was difficulty with erections. So it's not so much to reverse a cause without a surgical procedure, but improve lifestyle. Now, for patients who have underlying vascular disease, let's say somebody has insufficient blood flow to their legs where they're having what we call claudication or difficulty walking. Well, if we improve the blood flow to the lower extremities, depending on where the blockage is, very often that can improve blood flow to the penis. But remember, the blood vessels that go to the penis are very small, they're very tiny, and they become occluded very soon, much sooner than blood vessels to other parts of the body.
Okay, thank you so much. All right, Dr. Chung, we will go back to you now. How does stress impact ED? And an interesting question here, is ED physical or psychological?
This is an excellent question. I'll try to answer it as simply as possible. It is a combination of both. Some patients can have erectile dysfunction because of both scenarios. Some patients can have erectile dysfunction because of physiological problems, diabetes, things like that we discussed. There are some patients who can have ED predominantly due to psychological problems. Sometimes it's really hard to kind of identify which one is which. In one scenario, in our men's health clinic, we have the opportunity to perform ultrasound studies for patients. This is a study where we use an ultrasound device along the penis to look at the blood flow. This can sometimes help us to identify whether there is a decrease in blood flow entering the penis, too much blood flowing out, or whether those blood vessel parameters are normal for the patient. So sometimes this is something that we can utilize to help distinguish that. One thing that I think can be helpful for patients in terms of learning how psychological scenarios can affect their erectile dysfunction is learning, in brief, what the nerve signaling pathways in the body are. As in the lay literature or lay people who are non-medical providers, you may have heard of these kind of sympathetic or parasympathetic pathways. Parasympathetic is what we call rest and digest. It's basically when you're relaxed, right? Sleeping, digesting. There's another side of the pathway called sympathetic pathway, which is what we call fight or flight, meaning you're running, you're getting chased, and you're kind of in threatening mode, active mode. So in terms of that, in order to get an erection, you need to have a good parasympathetic pathway. That's rest and digest. So if you have anxiety, which is your sympathetic pathway, that sympathetic tone can be higher. And therefore, it's hard for that parasympathetic or that relaxed nervous system to be able to get an erection to be activated in the way that it needs to be. So sometimes that's why anxiety, nervousness can affect erectile function. Hard to explain that in 30 seconds, but that's one way that we try to talk about it a little bit more in detail in clinic. And also psychologically can always affect, right? Erections are not meant to be 10 out of 10 every single time for patients, every time in their life, right? There are some days when people may feel more tired. There are some days when people may feel more interested in sexual activity. Sometimes they may be more in tune with their partner or not. And all those things can also contribute to psychological reasons why erectile function may not be good that day.
Okay, thank you. All right, Dr. Wiener, we will go back to you now. What percentage of males over 40 years old will have ED, and what are the 3 most effective ways to prevent it naturally?
Good question. So I don't know exact percentages, and I don't know that anybody knows percentages because you'd have to study the entire male population of a state or region, the United States, however you want to, whatever population you want to look at. But we do know that there are medical issues which are cumulative over time. So the medical issues that we face when we're in our 50s, 60s, 70s, and older may not be the same medical issues and are not the same medical issues that we had when we were in our teens, 20s, and 30s. Again, not intentionally being repetitive, but that's the importance of a healthy lifestyle so that disease processes don't have a chance to accelerate, which means healthy lifestyle in terms of diet, no tobacco, minimizing alcohol, and exercise.
Thank you. And do you have any sort of certain age that you would say that ED typically starts?
Again, that depends on what the patient's underlying problem is. There are some people who may have a familial tendency towards elevated cholesterol and lipids. So these patients, typically there might be a family history of heart disease. So they're visiting their physician earlier on, and their triglycerides and cholesterol levels are very high. They perhaps are on medications when they're in their 30s. So we might expect a patient like that to have underlying issues. A patient who has early onset diabetes, particularly if the diabetic state has not been recognized or adequately controlled, often will have both vascular issues as well as neurologic issues because of the neurologic effects of diabetes. And if that disease has started when the patient's in their 20s or 30s, then they're going to be affected sooner. Patients who've had trauma, patients who've had severe pelvic injuries, perhaps there's been some neurologic damage in the pelvis to affect those nerve pathways that Dr. Chung had been referring to, then those patients are going to be more severely affected. I would think that a healthy patient who is lean, exercises, doesn't smoke, uses alcohol, I don't want to say sparingly, but moderately, and maintains a good blood pressure and visits with their physician regularly would have a much, much greater opportunity to retain normal erections over a longer period of time than the patient who doesn't have those attributes.
Okay, yep, that makes sense. Certainly can vary depending on circumstance. So thank you. Okay. Dr. Chung, we will turn to you now and talk about some exciting new treatments. So do you mind just detailing a little bit about any new treatments or technologies for treating ED? And are there statistics of the efficacy of the therapies?
Sure. When people think about kind of emerging therapies for ED, they kind of classify these under regenerative medicine. It falls into 3 categories. The first category is stem cell treatment. There are some studies that have historically been performed. I'm talking about like 10, 20 years ago. This is not a common practice. This is something that should only be performed in a clinical trial standpoint, not something that should just be done gung-ho. Really need to be under supervised physician under a real study protocol. The second thing that people may look at online and identify is PRP. This is called plasma-rich protein. This is where they're taking blood and putting it back. PRP has a lot of application, for example, in orthopedic surgery. Some dermatologists use it for hair regrowth and things like that. And some people have it and use it for erectile dysfunction. It's called the P shot, or in terms of that, there is no data to show within urology that that is a functional treatment for erectile dysfunction. Zero. So in terms of that, when patients see me, I let them know, and perhaps they might want to think twice about getting that treatment, or perhaps really ask the provider in terms of what their experience has been with it and what they may actually gain from it. One of the most common treatments that exists that Dr. Weiner mentioned is low-intensity shockwave therapy. This is a device that we do have at the Men's Health Clinic and a treatment that we do offer. In terms of shockwave, it is still something that we're trying to learn how to best to use. However, there have been many meta-analysis studies which have showed that it's probably best for patients with mild to moderate erectile dysfunction. What I mean by that is maybe somebody who is on Viagra but doesn't want to be on it, and maybe they might be able to benefit a little bit, or maybe who's on Viagra who wants to do a little bit better on Viagra. But the data, at least this point, shows that it is unlikely to beneficial people to have significant erectile dysfunction, meaning that people who are doing injections onto their penis, for example, probably aren't going to benefit that much from shockwave therapy. So the reason we at Jefferson like offer this treatment is because we want to at least be able to have these conversations with our patients so that we can truly let them know what all of their options are. And we are providers who can also offer those to the patients as well if the patient wants them: injections, surgery, shockwave, for example. What I'd like patients to understand is that when they look up things like shockwave therapy online, a lot of these therapists and providers who are doing it are not actually even urologists. Sometimes they're a plastic surgeon, sometimes they're even a dermatologist, sometimes they're an emergency room doctor. So the challenge with that is that I personally don't feel that the patients are getting their fair shake in terms of what they could actually be doing alternatively. And if a patient comes to us and finds that shockwave is best for them, then after they've heard truly what all the treatments are, then I think it's fair for them to try.
Okay, some important information. Thank you. All right. Dr. Weiner, we will turn back to you. Are vacuum erection devices a good alternative to oral medications?
Yeah, they are. But again, as I had mentioned before, these are devices that work by drawing blood into the penis. So you have to have a baseline ability to get blood inside the penis. If a patient has significant vascular disease, that may not be adequate. One of the advantages of the treatment is that it is fairly safe. The only problem is that it can impede ejaculation because there is a constriction ring which is placed at the base of the penis, and that can be uncomfortable. And again, it would impair ejaculation. Some patients report bruising, which can happen. I think one of the benefits of it is that if used in conjunction with one of the medications like Cialis, Viagra, Levitra, Staxyn, Stendra, whichever one is available, it may tend to boost the efficacy of those drugs.
Okay, thank you. Another question for you here about effectiveness. Can ED meds lose their effectiveness over time, and why? What can be done for ongoing maintenance?
So that's an excellent question. And I would say that I think my opinion is that when drugs begin to lose their efficacy, it's also, or it's often because of whatever the underlying problem is, may not be addressed. So a patient, for example, whose diabetes remains under control, has ongoing issues with vascular supply and neurologic issues, often that go along with diabetes. So the drug is having a harder time, let's say, for lack of a better word, keeping up. The same thing for a patient whose cholesterol and blood pressure are not adequately controlled, or perhaps there's a new medication that's added which impacts upon the patient's ability to get a good response to some of these medications. The real question also is if a patient's using injection therapy, are these drugs safe long term? And there had been some discussion some years ago about some of the drugs that are used for injection therapy that cause scar tissue within the penis, but the newer drugs don't seem to be doing that as much. So patients who are using injection therapy, assuming that their underlying problem is stable and not progressive, drugs should maintain their efficacy over a period of time.
Okay, great. And what about for someone who says none of the usual medications work for them? What can be done in this case?
So again, that's where we would look to use combinations of therapy. The patient who has a mild to moderate response to Viagra, they might be a good candidate for the wave therapy that Dr. Chung was referring to. Perhaps a patient who says, I have no response at all to any of the medications, and I don't want to do wave therapy for whatever reason, that's the patient that we would counsel to use injection therapy. And for the patients whose injection, who don't respond well to injection therapy, are not satisfied with injection therapy, surgery is the best option.
Okay, thank you. All right. Before we turn back to Dr. Chung, I just want to say thank you for everyone who has been submitting questions live. So we will turn to our live questions in just a bit. But first, we'll go through just a few more submitted questions. So Dr. Chung, we'll turn to you. What are the impacts of type 2 diabetes on ED?
So type 2 diabetes is a little bit different than just high blood pressure, for example. As Dr. Weiner mentioned, high blood pressure can cause challenges to the blood vessels. Diabetes does the same. It affects blood vessels, but it also affects nerves. So kind of what in a silly manner, kind of discuss with my patients, I say is, we've heard of end stage patients, how they may lose sensation in their fingers, or sometimes unfortunately have their fingers amputated, for example, because of decreased blood flow and decreased neurovascular of their extremities. I kind of say, well, that is kind of similar to what can happen to erectile dysfunction. Not saying that their penis is going to fall off. That's not what I'm saying. What I'm saying is the nerve endings, as well as the blood vessels that go to the penis, can experience that exact same type of trauma that people see with diabetes. So going back, in terms of what Dr. Weiner and we were discussing earlier, is that this is a great time to capture patients with diabetes to help them to kind of focus more on preventative care, not just talking to us just about their erections, but trying to motivate them to see their endocrinologist, or seeing an endocrinologist, or if they don't have one, or following up more closely with their primary care physician. And it's another opportunity for us to provide that entire patient care for them. I'd say in terms of the last question, in terms of why medications don't work, that was answered excellently. But I always just want to emphasize to patients that just because you're taking medicine for a disease, hey, I'm on metoprolol for my high blood pressure, or I'm on medication for my diabetes, it doesn't mean that the high blood pressure and the diabetes went away. It's still there. So I don't think all patients understand that. So we try to take that type of teaching approach in our clinic so people understand that, so they can react to it and focus on other parts of their health in addition to what we're helping them in the urology clinic.
Okay. Thank you for that call out there. All right. Our last submitted question before we turn to live questions from the audience, Dr. Weiner, this one is for you. How can someone keep their erection without pills?
So that vacuum constriction device that we were referring to is probably the best alternative. It's a plastic cylinder which the penis is placed inside, and air is evacuated from it. And at the base of that device is a very tight-fitting constricting ring. And after the erection is achieved, the ring is slid off the plastic cylinder to the base of the penis, and that traps blood inside the penis. It's not the most spontaneous of devices, but it does work to trap blood inside the penis. I would caution patients to be careful about the type of device that's used. Um, a device should, the constricting ring should not be metallic. It should be rubber or very thick plastic, and it should be able to be removed. Unfortunately, I've had the experience in years of practice where patients have placed these constricting rings at the base of their penis with the idea to keep the blood flow in, but the rings are metallic. And now blood flows in, but blood can't flow out. And all of a sudden there's swelling, and that swelling becomes worse. And it's like having a ring on your finger that you can't get off. And that requires emergency surgery. And the surgery is not always, I don't want to say successful, but it's not always easy. So if a patient decides to use a type of constriction ring, it should be the type of ring that is pliable, flexible, and definitely not metallic.
Okay, definitely good to keep in mind. Thank you. All right, we will turn to our live questions now. So we'll dive right into it, and whoever wants to answer, feel free to chime in. But for the first question, this person is wondering, I am on the kidney transplant list. If I have the transplant completed, will this help with ED?
This is a good question. I really think that this population of patients are underserved in terms of their erectile function. They have a lot going on. Many of them are on dialysis, takes a lot of time. Seeing another provider is not on their list of kind of activities. And often their vascular team are most focused on their transplant and not focusing a lot of time in terms of asking them, would you like to see someone to improve your erections? So I'd say in terms of patients, when they're on the transplant list, for example, it means that they have pretty severe end-stage renal disease. Going back to how the kidney works, the kidney has tiny, tiny, tiny blood vessels and millions of them, which help to filter the blood to make urine. So if you can imagine, if the kidney is dead, well, then the blood vessels going into the penis are probably also dead. So in terms of these patients, most oral medicines really, really aren't going to work for them. They are pretty off the charts in terms of erectile function in a negative way, and will really need something more like injections or moving on to a penile implant for surgery.
Okay, thank you. And Dr. Wiener, anything you'd like to add there?
I think Dr. Chung described that perfectly.
Absolutely. Okay. All right. Our next question here. This person says, I am almost 70 years old. I have no evidence of cardiovascular disease, but have ED issues about 80 to 90% of the time. I'm concerned that ED is a sign of an underlying and undiagnosed issue. Should I be concerned about heart disease being responsible for my ED?
Yeah, I'll take that. And I think the answer to that is an unqualified yes. As we've mentioned before, erectile dysfunction has been identified as one of the most reliable indicators of underlying cardiovascular disease, specifically because, as Dr. Chung mentioned, those blood vessels that feed the penis are so small that they become occluded, and that happens very much before we start to see effects in other organs, such as the heart or the brain, where the blood vessels that feed those organs and muscles are much, much larger. So the idea behind the men's clinic that we have here at Jefferson is to identify risk factors for all types of body issues, not only erectile dysfunction. And we do a thorough screening through the clinic and refer the patients to the appropriate specialists so that accurate diagnoses can be made for overall health.
Okay, thank you. All right, next question here. What types of surgeries or treatments are available to repair penile tissue? Is this something that is offered at Jefferson?
At this very moment, we don't have any surgical options to repair the tissue. The closest thing that we have to repairing or regenerative medicine that we have data for is shockwave therapy. The idea and the science behind shockwave therapy is that with the ultrasound, you are causing a micro trauma. it's not a painful procedure or painful process, but the idea is that through the microtrauma, you're inducing growth factors that will kind of come to the area of the microtrauma, the penis, and help to induce healthier tissue and healthier blood flows to the areas. So at this moment, that's the closest thing that we have to kind of restoring actually what exists. Every other therapy that we described, vacuum therapy, injection therapy, oral medications, for example, these are all just therapies to help stimulate blood into the penis to kind of help with the side effect of erectile dysfunction.
Okay, thank you. All right, next question here. How well does Eroxon work? Are there prescription topical erectile dysfunction medications?
So Eroxon is, we've had a bunch of questions I see come across the chat for patients who are interested in that. Eroxon is a therapy which is topical. It works to cause a dilation of blood vessels on the skin. And the idea is that it may be absorbed through the skin to allow dilation of blood vessels. But this goes back to Dr. Chung's first question to talk about supplements. Eroxon does not have any medication in it. It is not regulated by the Food and Drug Administration. It is actually classified as a medical device, just like an oxygen machine would be, or a penile prosthesis, or any other piece of durable medical equipment. And because of that, it's not regulated by the Food and Drug Administration. And it is not under medical supervision. So you don't need a prescription for it. It's available over the counter. I'm pretty sure you can buy it on Amazon, but I don't think that it's the type of medication that is going to revolutionize erectile dysfunction treatment. From what I've read about it, I haven't any experience recommending it to patients, or I've never even seen it. All disclosures, but it almost sounds like Vicks Vapor Rub, where you get that warmth and then cooling effect, which is how it's described.
Okay. Well, thank you. All right. Next question here is about high blood pressure. This person says, I'm 66 and have high blood pressure. What's the safest way to address my ED? Does Viagra or Cialis is it possibly dangerous for patients with high blood pressure?
I don't think that these drugs are, that drugs that are used to manage blood pressure are dangerous for erectile dysfunction. And said the other way, drugs that are used to manage erectile dysfunction are not dangerous for blood pressure. The only contraindication to using a drug like Viagra or Cialis are patients who are taking nitrates along with it. Drugs like isosorbide, for example, or if you carry around nitroglycerin in your pocket and periodically you pop one because you get chest discomfort. That's an absolute contraindication to using drugs like Viagra and Cialis. And the reason patients were having problems when those drugs first came out is that those drugs work together. It says what we call a synergistic effect. They work together, and they profoundly drop the blood pressure so that the patients were suffering from extraordinarily low blood pressure, which could not sustain their organ function, and that's what was causing their death. So these drugs are safe when they're appropriately prescribed by healthcare professionals, which again is why it's important when patients visit their doctor to be completely transparent about any medications or treatments that they're taking. Very often we hear, oh yeah, I forgot that I took this, or oh, I forgot to mention that, or we'll go through a medication list and say, oh, I see that you're taking Imdor. Oh yeah, I forgot to write that down. So those are the things that can get somebody into trouble.
Okay, definitely good to keep in mind. Thank you. All right, next question here is about wave therapy. This person says, can wave therapy work for someone who has been struggling for ED for an extended amount of time? And how many treatments would it take for someone before even noticing a change?
Yeah, I'll take this question. In terms of wave therapy, shockwave therapy, the best information that we have is based on trials that have been performed are for patients who have mild to moderate erectile function. Those patients have the best chance of having some benefit from the therapy. I think in terms of how long someone has erectile dysfunction for, that is not something that was accounted for in the studies. They just looked at the kind of extent of ED at the time of treatment. In terms of, while we're talking about shockwave, I just see another question here that I'll just answer. The question is does the shockwave therapy, the Phoenix, also work as effective as ones that, say, the one that we utilize in the hospital? So for people who've looked for this device online, it is an at-home shockwave therapy device that I think you can buy on Amazon. It's about like $700 or something. So this thing is not cheap. There is no data to support that this thing works. So the challenge is that if you look at the scientific articles about shockwave, you'll actually see that the actual type of shockwave that's generated is actually very important. Gains wave, for example, there's actually studies that Gains wave does not work. So Gains wave is actually not a shock wave. It's actually a radial wave. Although you may think it's a shock wave, it's not. And the most recent study that came out looking at Gains wave showed that it did not work at all for those patients and there was no benefit. So the type of shockwave therapy that we have at Jefferson, for example, and that what a lot of other urologists are using, if they know the science behind it, is a real shockwave therapy that actually is going to be strong enough to be able to generate that micro trauma. So in terms of what I recommend someone to buy a Phoenix, I wouldn't, because we have no data to support that.
Okay. And just another reason why the research and data is so important. So thank you. Okay. Going to our next question here. I have a spinal cord injury to my T1 to T6 spine and face ED challenges. I've had a positive reaction to Viagra. Is there any reason to believe this may not continue to work? Are there any other options that I should consider?
I think in terms of this question, in terms of that, fortunately for most patients who have spinal cord injuries, the injury is stable. So I would say as long as your other health conditions are such as diabetes, high blood pressure, cardiovascular disease, are non-existent or maintained at the level that they are, that you should be able to continue in terms of that. What I always ask patients in terms of kind of what the best treatment for them is for them to consider and think about, what do they actually want out of it? Do you actually want to take a medicine every day? Do you like the side effects of it? Do you like putting a needle in your penis? Do you like putting this device online? Do you like considering surgery? So I want people to kind of think about what they want for the long term as well, not just exactly what's working for them. That way they kind of, what works may not be exactly what they envision in terms of how they have sex, how what they kind of how they would like to have sex in the future in the long term.
Yeah, definitely some important options or questions to ask yourself. Okay, next is about Botox. So is bladder Botox an option for ED? This person is wondering.
Bladder Botox is not approved by the Food and Drug Administration for erectile dysfunction. Botox is used for patients who have a variety of medical problems in every body system, from nerve damage to overactive bladder, but it does not have a demonstrable role in the management of erectile dysfunction.
Okay.
I would just add one thing to that. In terms of bladder Botox injection for erectile dysfunction, there are a few, if you look it up online, there are a few clinical trials for doing that. I would say, and be very hesitant to anyone, if they are paying to have that done, they should probably be under a clinical trial, because there's not any real evidence that's solid showing that it is an effective treatment.
Thank you. All right. Okay, turning to our next question. This person says, I've had prostate cancer, which was stage 1, treated with radiation, and developed ED, and now cannot ejaculate. Will this change or be corrected over time? I was prescribed Viagra, but this hasn't had a real impact.
So one of the most common reasons that patients have erectile dysfunction is following prostate cancer surgery. And I would say that for most men, that is one of the biggest barriers to effective treatment, is that they're afraid of being diagnosed because they're afraid of the treatment. Uh, Radiation works by causing a controlled scar. It's a thermal burn, which is controlled by the radiation oncologist, with the idea being to kill all the cancer cells as well as normal prostate tissue. You can't separate the two when radiation is being performed. The nerves that travel adjacent to the prostate are the nerves that are responsible for erection. And as we've said repeatedly tonight, erections depend on both blood vessels as well as nerve function. So when radiation affects those nerves, or during surgery, if those nerves are not salvaged or spared, patients may have difficulty with erections. Um, with radiation, once the damage is there, sadly, it's not recoverable. In terms of ejaculation, the patient would not ejaculate either because of the underlying ejaculatory mechanisms which allow semen to be brought forth at the time of orgasm. So that's where we use adjunctive treatments. Viagra, as the patient mentioned, is not designed to improve ejaculation, but to help sustain the erection and improve blood flow to the penis. But that is the type of patient that perhaps might benefit more from injection therapy than Viagra and Cialis.
Okay, thank you. All right, this next question here is talking about online medication services. So this person says, I'm currently using a product provided by an online medication service. Are there any risks involved with using a service like this?
This is an excellent question. There are many online services, Hims, Blue Chew, for example, and they are definitely providing a service. Their service that they're providing is helping patients improve their erectile function by not actually physically seeing anyone. I'd say personally, as a physician who practices and focuses on erectile dysfunction, I think this can be challenging. I understand that it's nice and easy for the patient, but the challenges are a few. Number one is that they may not have the opportunity to fully understand what all their options are. Number two, they may not have the opportunity to get blood testing, for example, for low testosterone. They may also be skipping a physical exam to kind of understand and identify other challenges that may be going on. And there was also a study that was published about 2 years ago looking at the cost. So the cost of using Hims, Blue Chew is actually extremely high. At Jefferson and at a lot of other places, we have telehealth. So you can talk to Dr. Weiner and myself from the comfort of your couch, from the comfort of your chair, in your car when you're not driving. But we can actually provide the similar type services in a more comprehensive way. We're thinking about your heart. We're thinking about your diabetes. We're thinking about your high blood pressure. And yes, sometimes we may need to have you to come in so we can start that relationship together. But for actually a lot of the follow-up, you can do virtually about these things. So although it may be really easy to just use your phone to log on to Hims and Blue Chew, you're actually paying a lot of money for that. And we really feel strongly that we as urologists in the clinic can provide a more comprehensive, a more thorough evaluation and a more personal relationship rather than pursuing those online other markets.
And I'd like to jump in on that to Dr. Chung's point, and that is, if there's a side effect, if there's a problem, and you have a relationship with a physician, whether it be the physicians at Jefferson or whatever physician you choose to manage your erectile dysfunction, that's a person who's dedicated to taking care of you as an individual and is there to backstop you if there's a trouble. If you get into it, if there's an issue and a patient is using these medications that are online and they have a side effect or there's a problem, there's no one to back you up. There's no support structure in that relationship. And that's truly what comprehensive medical care should be about, is that you have a team of physicians or a physician who is available to you to answer your questions and not only recommend what's best for the patient, but also in times of need, there's a structure there to help you.
Yeah, and one other thing is this is also very similar to men's health clinics that are not run by someone who specializes in men's health. There are many clinics that exist that are easy to get into, where they're doing testosterone, for example, or penile injection teaching or erectile dysfunction treatment. They have the technical ability to prescribe these medicines because they're a medical doctor, for example, but they don't have the surgical expertise, for example, or the procedural technique to help follow through with the complications that can come with that. So there are many of these types of places all around the city, all around the nation, up along the coasts. But that is another area where sometimes patients can have trouble because they're seeing a provider who can't provide that full round 360-degree care from beginning to managing all sorts of side effects of potential treatments, which fortunately are low, but still you need someone there to help you.
Absolutely. Yeah, an important subject. So thank you to who submitted this question. Okay, next question here. This person says, does the use of medications for ED rely on body size or body weight? I take 5 milligrams of tadalafil daily and 20 milligrams before intercourse, but still have issues. Do I need a larger dose?
Yeah, that's a
Those are-
good. Oh,
No.
go ahead.
No, I'll jump in. You go. I'm fine.
So in terms of that, I think in terms of the daily dose, people don't understand exactly what's going on. And this is very important. When you're taking 5 milligrams daily, the reason why you can do that is because the half-life of that medicine is almost about 18 hours. So that medicine actually accumulates into your body. So you're not just taking 5 milligrams, it accumulates. I'm sorry, you are taking 5 milligrams, but it accumulates to the point where you have about 18 or 19 milligrams in your body at all time. That's the equivalent of Cialis 20 milligrams that you take on demand. So the benefit of doing that is since you have that maximal dose in your body, it allows you to have more spontaneous sexual activity where you don't have to worry about the timing. But Cialis 5 milligrams daily is technically the maximal dose. So I want to be very clear on this question. What he's asking, or this participant is asking, is about off-label using of dosages of medicine. So this is an off-label situation where the patient is taking a higher dose of medication that's then traditionally approved by the FDA. I have many patients where I do this, but we do this under understanding of that it's off-label and also discuss about the potential side effects that can happen. So this is not just a regular scenario where someone goes and tries this by themselves. It needs to be under the right scenario and understanding of what exactly is going on. So
Yeah, part and parcel of that is drugs are designed at a certain dosage for maximal efficacy. And 20 milligrams of Cialis, for example, which is the maximal dose, is not inferior to 100 milligrams of Viagra. People think, oh, because it's 100 milligrams, it's 5 times as strong as the 20 milligram Cialis. These are different drugs, different compounds that have a similar basis for action, but adding in extra dosing raises the risk of serious side effect without necessarily improving the response. So 200 milligrams of Viagra may not be better than 100. 40 milligrams of Cialis is not going to necessarily be better than 20. But the side effect profile is much higher when drugs are used outside of their recommended dosages.
Okay, thank you. And obviously just an important reminder to speak to your healthcare provider. So thank you. Okay, next question here is about cost. So can the doctors provide a rough estimate of patient cost related to implants for ED? Does insurance cover some or all?
Yeah, insurance does cover a lot of them. It depends on everybody's insurance policy, and certainly that's a very difficult thing to negotiate in this day and age. But many insurance companies, particularly if Medicare is the primary, do endorse the coverage for penile implantation. But before that is performed, I know at Jefferson, what we do is that we make sure that the patients are fully informed as to what their responsibilities may or may not be, so they can make an informed decision.
Okay, thank you.
Just to add on that real quick, I think in terms of, Dr. Wiener and I have an extensive experience in penile implant procedures. The benefit of that is that our surgical schedulers are also extremely good and know how to communicate with the insurance companies. Unfortunately, as good as our team may be, unfortunately, it's just not covered. In those scenarios, there are opportunities to do self-pay, or sometimes patients can wait a few years and maybe Medicare might kick in. So those are the things that we understand and can at least teach people about what the options may be.
Okay, thank you. All right, next question here. This person is wondering if you could discuss a little bit more about Peyronie's disease.
Peyronie's disease is a process by which the penis becomes bent. We believe through micro trauma, which may have occurred incidentally over years, or for it's basically an inflammatory type reaction, and it causes the penis to lose its ability to be straight when an erection happens. Often it's associated with what we call a palpable plaque, or an area of firmness. So the penis is actually comprised of 3 cylinders, 2 cylinders that are on top that fill with blood. That's what gives us the erection, and a cylinder underneath, which is the one that carries the urine channel. So the penis does not erect uniformly when there's Peyronie's disease, causing a bending, and that bending can be in the initial phase can be painful. And that phase can last several months or even a little bit longer. And there are very satisfactory treatments for that. Those treatments might be medical, or they might be surgical.
Yeah, one last thing to add on that is these are obviously difficult things to talk about, ED and curvature of the penis, and they actually occur a lot more than people think they do. We as men just don't talk about things as much and aren't as open about it. But if you look at the data, it's more prevalent than you think it is. I think one of the advantages of coming to a men's health clinic is that we know, Dr. Wiener and myself, for example, how to treat both of these conditions. So often you're going to see one provider who may knows how to do a little bit of Peyronie's, maybe a little bit of erectile dysfunction, maybe offer you some treatments, but not all of them, and maybe not all of them for both. But those are definitely some of the advantages of coming to a Jefferson's Men's Health Clinic, because we can help you in all those ways.
Absolutely. Thanks for that call out. All right. We'll take a few more questions here and then wrap up for the evening, but we have certainly been receiving a ton of great questions. So thank you all so much for your engagement. Okay, the next question here, this person says, can the doctors discuss Muse therapy as an option for ED?
Yeah, Muse is something we've ignored, and I apologize for that. But Muse is a drug called alprostadil. MUSE, but alprostadil is the active ingredient in the injection therapy that we typically use for patients who have erectile dysfunction. But Muse comes as a little pellet about the size of a grain of rice, and it's placed inside the urethra, the channel that carries the urine, about 20 to 30 minutes before intercourse is anticipated, and the drug is supposed to dissolve inside the urethra and be absorbed into the tissue. It's a little bit uncomfortable. It's somewhat difficult to obtain because not a lot of pharmacies carry it. But it's a pretty much of a local treatment, and it has some degree of success. But I think over the last couple of years, it's kind of fallen out of favor, mostly because it can cause a lot of irritation, particularly because it's a medication that's being dissolved inside very tender tissue, I guess is a good word for it. But it doesn't seem to have the efficacy that, in my opinion, it doesn't have the efficacy of using the drug in the injection form.
Yeah, I agree with Dr. Weiner. I think this is my 7th or 8th year of practice, and I have never actually once I prescribed it because a patient really, really wanted it. And even though he really, really wanted it, he couldn't find it. And then when he found what the cost was of it, he couldn't afford it. So even though this is something that we talk about, this is really a treatment that's more historical now. The other benefit or the other challenge that Dr. Weiner mentioned is that the efficacy of it. So I personally feel that most patients who are willing to put a pellet into their urethra is probably better off and willing to inject their penis, where they can actually adjust the medication dosage to be able to get exactly what they're looking for and the duration of an erection that they're looking for.
Yeah, that's very well said.
Okay, great. All right, let's go ahead and we'll just take one last question to wrap up the evening. And then I myself have one final question. Okay, so for the last question from the audience, this person is wondering, are there any safe treatments for dialysis patients who are experiencing ED?
Yeah, Dr. Chung answered that very expertly at the beginning of the question and answer session. So sure, patients who have kidney failure that are on dialysis clearly have issues with blood flow throughout the body as manifested by kidney failure. So these patients would do very well with injection therapy. I'm not sure that, in my experience, that drugs like Viagra and Cialis have proven very helpful. Certainly, they're worth a try because with the cost of medications, some of these medications can be purchased extremely, extremely cheaply through some of the pharmacies that we know and utilize. Having said that, I think that the optimal treatments for patients, in my experience, who are on dialysis would center around penile injection therapy or implantation of a penile prosthesis.
Okay, thank you. And thank you all for submitting your questions. So for the final question for both of you, what would you like attendees to take away from this webinar? And are there any questions you suggest that patients ask their doctors? Dr. Chung, we'll go ahead and start with you.
Well, first of all, Sarah, thanks for again having us. And I hope that the attendees have found this to be valuable for them. There's likely a lot of you who still have questions. So, people like myself and Dr. Weiner, we do this as our career. We like talking about these things. We like meeting people who are looking for help in their quality of life. And that's why we do what we do. So I'd say feel free to, try to see us if you're interested, and we can further work out what your challenges are. The other thing that I'd say is that, many people have these same issues. So I think we as men also need to just be a little bit more, a better job about being more vocal. So I'm proud of all the people for attending this event. There are many people here, you may not know it, but there are many people just like yourself who are interested in having a better quality of life out there.
Absolutely. Yep, I was going to say the same thing. Kudos to everyone joining tonight. All right. Well, thank you so much. And Dr. Weiner, we'll turn to you. Any final remarks?
Again, I'd like to express my thanks for sponsoring this, and to all the participants who've sent in some great questions, and we certainly appreciate your attendance and interest tonight. I will say that for as smart as we think we are as men, I think women are a lot smarter, because women tend to focus on prevention of disease. Men tend to focus on repair, and that's kind of a backwards way to think. So a lot of the questions that came early on is, how can I prevent it? What can I do? What can be done once the damage has happened? What are the treatments? The thing that Dr. Chung and I have tried to bring across is the best thing to do is an ounce of prevention. So that is maintain a healthy lifestyle, watch what you eat, exercise, don't smoke, minimize alcohol, visit with your physician frequently. It's very important to have periodic screening because many of the issues that men face are unfortunately silent. And by the time we find out about them, very often it might be so advanced that a patient's treatment options are then narrowed or limited. So, yeah, if you're over 50, get your PSA checked, get your prostate examined, have your primary care physician check your lipid profile, make sure that your hemoglobin levels are appropriate with respect to diabetes, and maintain a good diet. And this isn't easy. It's a job. It's not easy. And it's certainly a lot easier to not do these things, but the consequences can be very disheartening, and we're trying to prevent that.
Absolutely. Be your best self advocate. So thank you both. Dr. Chung and Dr. Weiner, thank you so much for your time this evening. We know obviously a lot of great information was shared tonight about erectile dysfunction and men's health overall. So thank you again. And thank you all for who joined and advocated for your health and submitted such wonderful questions. Tonight's discussion was really great. So thank you. We will be posting an event survey, so you can let us know your thoughts. Was this helpful? Are there any other specialties you would like to hear from? Your feedback will bring more virtual events like this to you, the patients. And if you'd like someone to contact you directly to schedule an appointment with a Jefferson Health provider, please fill out the last question in the event survey. We do have more wellness webinars coming up soon, so if any topic is of interest to you, be sure to sign up. A recording of this event will also be sent to you so you can rewatch at your convenience. And if you would like to view other wellness webinar series events, please visit our Jefferson Health YouTube channel at youtube.com/Jefferson Hospital. We have everything from back and neck pain to robotic surgery to planning for pregnancy, age-friendly care, and much more. If there is anything anyone here at Jefferson can do for you, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Have a wonderful night.